the Fund Healthcare Not Warfare organization or working group that keeps us, get this out of my face, doing this workshop or this webinar of Seeking Women's Health Justice is the first in a series of workshops or webinars that we will be having. And those of you that are here or have registered for this webinar, you will be receiving information about the future webinars that we'll be having. And I think it's really so appropriate that today we are having this on Women's International Day, because it really is an indication. It's the intersection of the work that Massachusetts Peace Action does, those of us who are working for women's health does, and what many people do not understand is that, or don't realize, is that Women's International Day was originally or started out as a socialist project and was involved with peace and anti-war and workers' rights. So that it's very appropriate that we have that for today. I'll just say a few words before we start with our speakers, in that before the pandemic, before COVID, a number of people didn't realize what a dysfunctional healthcare system we have. And certainly because there are a number of factors that influence this, such as discrimination, ageism, racism, ethnicism, and other factors that relate. Certainly one of the major factors that relates to how our healthcare system dysfunctions is because of a lack of resources. And one of the reasons that we have this lack of resources is that we spend our government spends our money in the wrong places. It's interesting, many people don't realize that the United States defense budget is over $800 billion for this year. To put that in a further context, that is even more than the next 9 countries spend in total. And that includes Russia and China in that as well. So that it helps us to realize that the larger context that we need to put all of our comments tonight into is the issue of how our government, how our society decides to spend its money. At the end of next week, you will be receiving from us a resource page, which includes some information concerning the speakers and the content of what we are speaking for tonight. In addition to that, which is a wonderful opportunity that we have, Rutgers University Press is being very, very generous and is offering each registrant for this webinar an opportunity to order any books from their whole catalog at a 30% discount with free shipping. So when you get the resource list on Monday of next week or beginning of next week, that information and the discount code will be in there for you. So now let us start with our speakers. We won't have cute questions and answers between speakers because that can get a little disruptive. We'll wait until all of the speakers have done their presentation, and then we will have questions and answers. And Kate Henning will be ordering that part of the webinar. If you have a question, you can just put it into the chat. So our first speaker presenter, and I am just absolutely thrilled to have her with us tonight, is Chris Chanya-Sulkit. And Chris has been a public health worker for many years, has energy, which I don't understand how and where she gets her energy to be involved with so many absolute aspects of public health, but she has always worked to make sure that she promotes racial, gender, and health equity. In addition to the various roles and responsibilities that she takes on, she offers very much to her own community. So she works within her community of Brookline, Massachusetts, in some of the various health organizations there. And in addition to that, she is the current president of the American Public Health Association. So Chris, welcome and thank you for being here. You're muted, Chris.
Thank you. Great. I can't unmute myself, so I couldn't figure that out. Thank you so much. So first, again, thank you so much to you, Catherine, and to all the many organizers like Professor Beth Summers, who I love, and so many others, the sponsors, APHA, the Massachusetts Public Health Association, the Women's Caucus, the Massachusetts there are just so many. I am so thankful. And I'm actually also really honored to be here as a part of this panel of phenomenal women and in the first of a series of webinars that you're going to be having on women's health issues. And of course, today on International Women's Day. So I'm going to be frank and honest. I'm quite nervous about how I can help us explore the issues of abortion health justice in 10 minutes or less. But I'm gonna try my level best. Apologies if I sound a little hoarse. I had COVID, then I had a root canal, then I had a sinus infection. And all I can say is we need universal health care, but that's another talk for another time. So again, hello, my name is Chris Chanya-Selkett. My pronouns are she, her, hers. And while I am president of the American Public Health Association and thankful for that, I'm also thankful to be a board member of the Planned Parenthood League of Massachusetts here in Massachusetts. So I'll bring you some detail, and all of this comes kind of from both hats. Sort of hard to separate what do I know one day from one hat to the other. So first and foremost, I want to be clear. Yes, we're talking about abortion, but APHA and myself as well, and likely, hopefully all of you, believe in access to the full range of reproductive health services. And that includes abortion, of course, and that abortion is a fundamental right. And it's integral to the health and well-being of individuals. And it's not just, for the broader and to the broader public health as well. And so APHA believes that. Furthermore, this overturning of Roe v. Wade truly jeopardizes, APHA came out and said it jeopardizes the health of all Americans. But something I want to sort of emphasize is that, this Dobbs decision isn't surprising. It might have seemed like it because I think sometimes we just sort of let the media go its own way. But yeah, the draft was leaked. But it wasn't like there haven't been assaults on women and one's autonomy already. Like this isn't going on. It's not that surprising. But yes, the Supreme Court did overturn nearly 50 years of precedent, eliminated the federal constitutional right by overturning Roe v. Wade. And we are seeing, hearing, reading, it's incredible, the devastation, the consequences as they are devastating women and families all across our nation, forcing people to travel an untold number of miles for care or to remain pregnant. So what I'm saying isn't surprising. And I also mean that at least in my Planned Parenthood League of Massachusetts hat and many others, especially with the leaked draft decision, we were preparing. We're always preparing, right? To make sure that at least in Massachusetts, abortion would remain legal and protected under state law. And many places were ready. This wasn't necessarily out of nowhere. And so I want to, because I try to be optimistic and hopeful, because, there are some days when, goodness, things can get you down. But I want to leave you with not only knowing that there's all this preparation and that we're not giving up this fight, but letting you know what is being done concretely here in Massachusetts, because in many ways we can be a leader for other states and places, and then also for you to figure out ways in which you want to join in on this. So, since the overturn of Roe v. Wade, there, of course, Planned Parenthood has really ramped up in Massachusetts the patient navigation and telehealth services. And something to say is, COVID, there are a number of things it did, but one is, telehealth has really come to a head. And so in that way, it was a sort of a positive. We've also added in a number of our in-clinic services in Massachusetts, in Boston, in Worcester, in Springfield. We've expanded our reach in education throughout Southeastern Massachusetts. And to just kind of give you the numbers on what that sounds like, because I think people are like, oh, there are 4 centers, what does this mean? Well, at least in Massachusetts, that means we see over 40,000 patient visits a year. When I say we're expanding our telehealth, that's over 7,800 telehealth visits a year. When we say we're fielding calls, that's almost 10,000 calls to Planned Parenthood's sexual counseling and referral hotline. And that's free. So we're there, we're helping people. We are helping over 5,000 patients receive medication abortions. So just to kind of give you an idea of like, what does that mean when we're doing this? Also, I don't know if everyone knows, but Planned Parenthood League of Massachusetts is the medical center. But PPAF, the Planned Parenthood Advocacy Fund of Massachusetts, is the 501c4 advocacy and political arm of PPLM. And PPAF is always prepared. The advocacy agenda is always ambitious, but since it's overturned, it also continued to look at ways to expand care, to make sure that care in Massachusetts was more affordable, and then also to make sure that the providers are supported and protected in this post-Roe environment, which is critically important. I mean, you're hearing news about providers being too scared to offer certain services, and what is that doing to patients, right? So PPAF engages the community, works hard, and your contributions and your efforts and your volunteerism with them know no bounds. Because of that, they elect bold champions for reproductive rights. We're not looking for legislators who want to come in and say, oh, we care about women. No, we're looking for someone to be a champion who will fight that fight, right? And I'm thankful to say that because of that, the PPAF had a 95% electoral win rate for our 2022 endorsed candidates, right? So just putting it out there to know that, we're doing it in all directions. Again, PPLM, the medical center, also launched the new Aspire Center. I don't know if anyone's heard of it, but it's a new center that's recognized for its expertise in research, training, and education. And all of it is looking into addressing the health inequities in reproductive care that are unfortunately now more important than ever before, right? And for example, now we know that there are many medical students who are not being able to learn these routine procedures that they normally would in their own states and places, or routine procedures like abortion or miscarriage management. They're not going to be able to get that. And we know that you need to train them to be the healthcare leaders who have this training. So Aspire is, for example, expanding its capacity by working with and leveraging their existing relationships with the community health centers that they have in Massachusetts, the hospitals, and other places. So I don't want to leave us all to be like, oh, Roe, post-Roe. No, it's I think we have a fire going where we're stoking it. We've been prepared. We're ready to fight this fight. And to not give up, because I will talk about many more things soon. But to know that Planned Parenthood and its executive team is forward thinking in many ways, but also really just trying to think like, how do we want to work with our state to make sure that this is really happening? So for example, they're already working with the Executive Office of Health and Human Services. They're establishing historic reimbursement rates that will hopefully help to address the reproductive health inequity for women of color as well for their reimbursement rates. They're doing a lot of work at the telehealth reimbursement rate parity, and they have 3 priority bills that likely Senator Miranda can talk about as well, which will look at telehealth, again, at sexual education, at abortion care, because those are significant key areas that would be a great benefit, in particular for communities of color and women's health. So I'm going to share all of this, but and I could go into more, but I know my time is limited here. But I want to say, so for me as someone who's in public health, works in public health, and we're still in a pandemic. I'm trying to be hopeful and optimistic, but at the same time, I'm like really angry because I can't understand the hypocrisy that a lot of folks have who in the same breath will cite their personal freedom not to put a mask on, but they want to take away the personal freedom from women and so many others. Like, I cannot wrap my head around it, and it makes me angry. That's a talk for another day. So we're gonna figure out how to channel that anger. But now I'm gonna try to figure out, what do I do with this anger? I have 2 minutes. Oh, 2 minutes. Okay, so 2 minutes. This year I am so thankful to spend this year going around our nation talking with folks with my American Public Health Association president hat. And I usually talk about 3 things, but I'm only going to talk about one thing because I have 2 minutes. And that is what I think is critical to the exploration of abortion health justice, to anything that we really hold near and dear to our hearts, because I'm fed up and I'm angry and I'm tired. Enough. All right. And that is, I want folks to vote for health. Now, lots of research has shown, Professor Beth Summers from BU, lots of research at BU shows that voting at the state and local level directly impacts the conditions that affect your health. For example, transportation use, zoning, housing, affordable housing, not having housing, whether kids can go to school, wearing a mask or not. All of this is local. So when I say vote, yes, vote in your presidential election, but vote local as well. Like, it's critical. For example, the people who you vote for your school committee, that can help determine whether or not your school district will have age-appropriate, sexually accurate, culturally competent sexual health education, right? So all of this is incredibly important. We need to understand that we need to vote all the time and vote in our local elections. And I'm almost done, Catherine. And I have 2 things, maybe 3, is that a lot of times the person who you vote for in your local election, for that school committee, for that library trustee, that city councilor, whoever you vote for, in no time, that person is often running for your state office and maybe just running for Congress. I've seen it in very positive ways, and I've seen it in not so very health positive ways. So we need to really recognize that we need to vote local, because our vote is our voice. And we need to vote folks into office, vote them out of office, hold them accountable. Because survey after survey shows the majority of Americans support abortion. We saw it most recently in elections, but we need to use this power of voting. We have it. And to vote, because your health is always on the ballot. And, just as Catherine started off, I'm going to end it by saying, the US spends about $3.6 trillion with a T dollars annually on health. But less than 3% of that spending is actually on public health. And then actually one more final thing, I guess there's always 3 with me, Catherine, is I'm thankful to celebrate the International Women's Day with you all, but it's crazy to know that for the first time in over 50 years, we're celebrating this day today in a country that we don't have abortion nationwide. Okay, so vote. I have more to say, but I'll talk later. Thank you so much.
Thank you, Chris. That was wonderful. And I certainly wish we had 3 hours for you to speak, which I'm sure you could. Okay, our next speaker is Sashi James. Sashi is the Director of Reimaging for Families for Justice and Healing, and that is an organization that works to stop incarceration of women and girls. And in addition to being an advocate for women who have been incarcerated and who are incarcerated, she works with the Women's Bar Association to help train lawyers so that they can be advocates and supporters for women and their appeals. So, Sashi, welcome and thank you for being with us.
Hi, everybody. My name is Sashi James, and thank you for having me. Thank you, Masterpiece Action, for having this panel. I really appreciate y'all. I also want to shout out your membership for walking. Some members walked with us 2 years ago for our long walk to stop a new women's prison. And I want to honor that because it was a hot week and y'all held out with us, and I appreciate y'all. So my name is Sashi James, and I'm with Families for Justice and Healing and the National Council for Incarcerated and Formerly Incarcerated Women and Girls. And we do work to end incarceration of women and girls by creating different infrastructures that literally stop the flow of women and girls from either entering prison and then also creating a community for women who come home off clemency or medical parole or elderly parole or women who are just being released, creating a safe community for women to come home to, so that way they won't even enter back in prison. I'm really excited to talk about women's on International Women's Day. One, because I really believe women will save the world. And that's why we need to free all of our women that are currently incarcerated so that way they can come heal us and possibly cure COVID. But even more today is important because the health care system that the women are receiving and while incarcerated is just sad. It's poor. Women are not getting what they need. My mom, I'm the daughter of formerly incarcerated parents, and one of the comments that my mom always makes, and I although it's a joke now that my mom is home, but it's not a joke because it's still very accurate, but she always talks about how when, they don't give you access to tampons and, basic needs that women need every month, and how they have to be creative when they're incarcerated. And these are things that people on the outside are fortunate enough to have access to and go to the corner store or go to their local CVS and be able to purchase these items. But when you're incarcerated, you're very limited on what you may be able to purchase, what you have access to. And all of these things just lead to poor healthcare, poor health system, poor not being sanitary, and beyond. And to think that we would allow our women to live in those conditions is just heartbreaking. I also want to uplift the fact that we lost a sister who, as we fight every day to bring women home on medical parole, elderly, clemency, when women like Miss Angie, who was serving life, been in prison for 32 years, when we fight to bring them home, and sisters like Lizeth, who has passed away because she had cancer, had her gynecological visits had been met, she would have been aware that she had cancer long before when she came home, and then it was terminal. She would have been alive today if DOC had met her needs. And this is a problem in our healthcare community with incarcerated women. Their healthcare is not being met, it's not being addressed. And we need people that are listening to call on DOC and demand that they follow up with the women and they listen to the women when they say that they're not getting any treatment inside of Framingham. And when our women come home and pass away after only 6 months to a year, after they've been inside of a prison for decades, it just breaks my heart, because where is their life? And how are we centering people's lives when they're incarcerated? If you're incarcerated, DOC has an obligation to make sure that every appointment is met for their health. It's not, there's no question about that. You are holding a person hostage inside of a cage. You need to make sure that they meet. If they complain about a headache, we need to figure out, why do you have a headache? The same way we can go to the hospital and get healthcare and say, I'm in pain, is the same way our women that are incarcerated should be able to do the same thing. And it's not being met. And so calling on legislators and having legislators to listen to the women that are inside. Right now, we have women that have dementia inside of Framingham who are incarcerated and don't even know why they're incarcerated. A woman with dementia needs to be outside in the community, getting the proper care and proper treatment that she deserves, so that way she can live out the rest of her life as healthy as she can, because prison is not going to help her at all. And uplifting the voices of the women that are incarcerated is important. Our sisters write us every day telling us how they can't see the nurses, when they're in pain, they're not getting any type of treatment. And we need legislators to start going inside of these jails and listening to the women. and figuring out what do women need so that way they're not dying immediately after they come home from prison. Also, when women are going into prison, we also have to listen to the fact that substance use is a big deal because that's also a part of the health issues for women. And right now, Framingham has a high rate of overdosing women that are incarcerated. And that is not addressing anything because immediately after you send a woman home, they're struggling with substance use. And so how are we getting to the root issue of treatment? So that's not going to help us. So giving women incarcerated over medicating women incarcerated is only causing further harm. I'm a daughter of formerly incarcerated parents. My mom, my sisters, my leaders, they all have been incarcerated, and they all say that prison does not help. Prison does not get to the root issue of the healing. It doesn't get to the root issue of the harm. It only causes further harm. And so giving women the voice that they need is really important, and uplifting the voices. I'm really excited. I'm the director of Reimagining Communities for Families for Justice as Healing. And even as a community member that is not incarcerated, I struggle every day as a Black woman to use my voice in the healthcare system. And empowering people to use their voice in the healthcare system is so important because we're sometimes, especially Black women, are voiceless and people just don't listen to us. So imagine being incarcerated and really not being heard. And so I appreciated everything that Chris has shared today. You know, it was so important to just hear you when you said about, you know, having access to abortions and having access to, you know, Planned Parenthood. And no worries. And y'all know I can go on and on and on, just like you, Chris. But having access to all of these things is something, as a person who is not currently incarcerated, is a luxury. But when our sisters inside don't have this access, it just breaks my heart. And my mom went to prison when I'm a mom. Y'all know I'm a mom. I have a daughter who's Katori. And, you know, one of the things that I always think about is that when my mom went to prison, she was nursing. And for people that have nursed, you know how painful it is when you start to wean your child off of nursing. And to think about the pain that my mom went through when she was incarcerated, and to think about all of the other women that are incarcerated with the pain that they went through while they were weaning, or even if they were pregnant inside. And thank God in Massachusetts, we ended shackling of incarcerated women. So shout out to Massachusetts for leading that. But there's so many other avenues that incarceration is only breaking women down that are incarcerated. And I'm gonna end here. But I just wanted to say that our matriarch of our organization, her name is Phyllis Hardy. When she was incarcerated, we fought hard to bring her home. And when she came home, she was wheeled out in the oxygen tank and in a wheelchair. And now that she's home, she's been home for a while now, but she's running around, bossing us all around and telling us what to do. And that's a perfect example of how incarceration literally breaks our women down. And when a woman is 70 years inside of a prison, we have to add at least 30 years to that, because the conditions inside of the food, the treatment, everything inside of a prison is horrible and hard for a woman. And so, or in a person. And so I wanted to leave that with y'all. And then I'm going to mute because I know I only had 1 minute and I know there's questions at the end.
Thank you, Sashi. That was really very heartbreaking to hear that. And it's something that is hidden. And I think that you're educating a lot of us here tonight, and a lot of society and the larger group of people need to be aware of what is going on and what the importance of healthcare for women who are incarcerated. Now we have our final speaker, and we want to give her a special thank you for being here, because she's been running back and forth and she's back-to-back meetings. Liz Miranda is well known throughout the Boston, probably Massachusetts, and probably the world area. She has been a representative in the Massachusetts legislature. She is now a senator in the Massachusetts legislature, and she has worked very diligently with various minority communities, Black and Latino, African American workers, on equity in healthcare. and she has been especially powerful in working with maternal issues and maternal mortality. So Liz, welcome, and thank you so much for being here.
Thank you so much. And I'm getting a little old, so I have remarks, but I just want to shout out Chris and Sashi. So much of what you guys shared actually connected to my own personal story. So I'm going to take the liberty before I begin my remarks to also thank Mass Peace Action. I've seen you guys in the building all 5 years that I've been in the legislature. And it's made a huge difference to me on how I legislate by having women like you and other members of other genders part of this group who have come to the State House, but not only shared what you'd want to do internationally or nationally or even locally, but that you are reminding us all that our values don't and shouldn't be checked at the door once we become elected officials. And so the work, particularly around Sashi, I want to spend a moment talking about my own personal story and how I actually got to the place that I realized that health equity and women's health was the most important thing I could work on. Because if I didn't work on that, we wouldn't even be alive to really relish in the fruits of the labor, whether it was changing educational opportunity, whether it was of housing or transportation or economic opportunity. If we're not well, if we don't live in safe and healthy communities, then none of that matters, right? And so my story begins in 1980. I was born in Roxbury. That's where I live. And I like to tell people I've been a legislator for 5 years, or four years and 2 months. I'm going on 5 years, but I've been a Roxbury girl for 42 years. And I grew up in a special place called the Dudley Triangle. And this is where I own my home. I bought my grandparents' home a couple years ago so that I could keep it from joining the thousands of other homes in Roxbury that have gone to gentrification. So I grew up here. My mom was a teen immigrant mom. She went to Madison Park High School, and in her junior year got pregnant with me, dropped out, and began a 40+ year career as a cook in Boston hotels. And so growing up in this community, the Dudley Triangle, there are 2 movies about this neighborhood. It's called Holding Ground and Gaining Ground. And there's a book called Streets of Hope. And if you want to learn about why my community is so important to me and why it's so important to even EJ communities across the world, is that a group of citizens, regular everyday people, some who couldn't speak English, created a campaign called Don't Dump on Us, because Roxbury and this Dudley Triangle was the most environmentally unjust part of the Commonwealth. It actually still is today. And we had 1,400 parcels of vacant land when white families, most of them Irish, Italian, and some Jewish, when they left after busing, was ordered upon our city to desegregate our schools that are still segregated, by the way. Some people burned their homes for profit. Some people just left their homes. Others, didn't care about the property that they had. But Cape Verdeans who were coming to America found this community to be affordable and a place where they could buy homes and buy land and build a community. I say all of that to say that we have a lot of power as residents of this state, whether we are newcomers, whether we've been here for 4 or 5 generations, to right the wrongs of history. And I like to see my work as sort of like a love letter to the little old Liz, like was 7 years old or 13 years old, who grew up in this community, who never knew that it was possible for her to be a senator. I never knew I'd even graduate high school to go on to Wellesley, and after Wellesley, choosing to come back into community organizing. I did everything everyone told me I was supposed to do. I studied hard. I, gave back to my community. And still in 2017, my youngest brother was killed outside of a Boston nightclub. And I was an executive director, and I looked at my life. I thought I had a dream job. And I said to myself, this doesn't feel enough. And every time I talk about my brother, I get a little emotional, so I'm sorry. But, being a Black woman from Roxbury, I feel like I've suffered through many, many things. And I'm so proud of myself and so proud of other people who have survived the things that Sashi and Chris talked about, to actually be here on Women's Day, International Women's Day, the Day of the Girl, in 2023 to say we're still here and we're not hidden figures anymore, but we've had to all go through a lot of suffering. And when Michael died, I pushed myself to think about what else could I do. And Massachusetts still is the safest state per the number of gun deaths that happen. But if you live in my community, or you're one of the 200 plus families that lose someone they love every year in the Commonwealth of Massachusetts, it really doesn't matter that we have tough gun laws. It really doesn't matter that we have the lowest number of gun deaths if someone in your family was claimed. So I go to the State House, I run an election, I win, I decide to run. I didn't know how to run, I didn't know how to write a bill, but somehow I did emerge in a program and got together with some of my sorority sisters, and I ran my campaign in the inner city here in the Fifth Suffolk, and I won that election in 2018. And that night made history as the night where 4 Black women won in the Commonwealth of Massachusetts. Then DA Rachel Rollins, Congresswoman Ayanna Pressley, myself, and my former House colleague, Representative Nika Elugardo. First time in history in Massachusetts. Is a very old state. The date, we can go back to Massachusetts Bay Colony. We can talk about the Puritans and the Pilgrims, but it took until 2018 for 4 Black women to win an election in this very blue state. And so I go to the State House, and my first week on the job, I hear about maternal health. And what surprised me was I'm not a mom yet, but I didn't really know the data. I didn't know the language that was being spoken in front of me by March of Dimes that was telling me that I was living in a place where Black women were still dying 2 to 3 times the rate of white women, and our babies were dying 6 to 8 times more than white women, and our children were being born with preterm weight, preemies, basically for short, as you hear in our communities, and we had higher rates of C-sections. And there was a huge problem, not only here in Massachusetts, but all across the country. And the worst 6 zip codes out of the 10 zip codes in the Commonwealth, which included Bristol County and Chicopee and Holyoke, were in Boston. They were my homes: Roxbury, Dorchester, Mattapan, Hyde Park, the South End, and Jamaica Plain. And I thought, how is this possible? How is this possible that in a state, in a city, we have the best educational institutions, best hospitals, best public health infrastructure, arguably in the world, biotech, entrepreneurship, that people were still dying while giving birth? That didn't seem to be normal. And so I walked out of that room, cried all the way in the elevator, and that led me to file a bill called the Maternal Inequities Commission, where we studied for a year the maternal health crisis here in Massachusetts, filed a report. It was voted on unanimously by the Senate and the House. And this little girl from Roxbury who didn't know how to write a bill passed her first bill. And I believe that work was really God sent in terms of the way that it was passed. And now I'm in the Senate and I'm doing much, much more. But I share all those stories to say that one of the things that I've learned being in the State House is that every issue is political in our lives. Every issue is local, and every issue is intersectional. And what I mean by those 3 things is that oftentimes we vote in presidential elections, and thanks, Sashi, for reminding us, and Chris, but we are not voting at the same rate locally to ensure that the state legislature, which is still the least diverse body in the country. In Massachusetts, Black women make up 2% of the Massachusetts legislature. There are 4 Black women. There are 3 Latinas. There are 2 Brazilians and 3 Asian women out of 200 legislators. And when we look at the total number of people of color, there are 24 out of 200. And so we have a long way to go to create the equitable distribution of representation. When we look at women, finally, we reached over 62 women in the legislature. So we are 30% of the state legislature, but we make up more than 50% of the Commonwealth of Massachusetts. And so we have a long way to go in equal representation of women. And International Women's Day for me has been a way for me to connect with my legislative colleagues to make them understand that although Massachusetts has done a lot of good, we have a long way to go. We have passed a lot of nationally renowned reproductive justice legislation, but for women that are underdocumented, undocumented, women who are living in rural communities or inner city communities, or lower income women are still facing a hard upward battle with their reproductive lives here in Massachusetts. We keep closing maternity wards. We keep closing birthing centers. And actually, there's only one birth center in Massachusetts right now, and that is in Northampton, Massachusetts. So the eastern part of the state does not even have a birth center for birthing people to have the options that they want to give birth in safe environments. During COVID-19, over 40% of families chose to give birth at home because they did not feel that hospitals were safe, or did not want to be disconnected from their families, or did not want to get sick, as hospitals were not safe places to be during COVID-19. So I will stop there. Sorry, Catherine. To share a little bit about one of the pieces of my legislation, but I want folks to know that I have a really robust agenda. I worked a lot on the police reform bill. Actually, 95% of my bill, An Act to Save Black Lives, was incorporated in the final bill banning chokeholds here in Massachusetts and creating a duty to intervene. But if you want to learn more, you can go to the Mass Legislature website and learn about all the things that I'm doing that are political, local, and intersectional to ensure that we're not having conversations just about our reproductive lives, but we're also talking about all the pieces of our lives that need to be taken into consideration when we're thinking about greater equity and justice in the Commonwealth of Massachusetts.
Thank you so much. I'm sure I speak for everybody on this.
So long.
That the richness of what we have just heard is really quite amazing. Three sparkling and wonderful individuals who have really informed us and given us insight and given us direction for ways that we can make a change in looking at women's health and bringing health justice, bringing justice to women's health. Now, Kate will now deal with some of the questions. If you have a question for any of the speakers or a generic question for all of them to consider, please put it in the chat and Kate will take it from here.
Thank you, Catherine. And thanks so much, Chris, Sashi, and Senator Miranda. Those were all such great presentations. I've been receiving a few questions in the chat and they've all been great. So I'm just going to go in the order that I've received them so far. So the first question is, and this is for all three people, anyone can feel free to answer, but to underscore the importance of recognizing the intersection of peace and health, could you please address how the language and concept of militarism has been adapted to women's health? So for example, the occupation of bodies and the loss of autonomy. And feel free to just, go ahead and unmute if you have a response.
Well, I could talk about it at the legislative. Since the beginning of time, I think this is what I hope was centered by all three of us being women of color, is that women of color's lives and bodies have always been militarized. And since the founding of this country, particularly for Black women who were enslaved and many times raped, and forced to care for their master's children, and also studies have been done on us, the OBGYN studies. We've had sterilization studies done in Puerto Rico. There have been lots of ways in which the federal government and the health industrial complex has been impacting us. But here at the legislature in Massachusetts, one of the things that I try to do is folks think that because we have such profound sort of reproductive justice and allies here. And we have NARAL pro-choice that is now Repro Justice Now. We have a lot of women-led organizations. We have a strong Planned Parenthood, that somehow we are out of the woods. But it does not apply to every woman. Not every woman has the means and the access. And so what I try to do is when I write legislation is I try to bring to the forefront this idea of it is racial justice work and doing reproductive justice work, because if we help those that are most marginalized, we actually help everybody, right? If you help the person that's at the bottom, we have nowhere but up to go when we're thinking about repro justice. The second thing is writing language. Words matter. And you would be surprised, out of the 6,000 to 7,000 bills that are written every year in the Massachusetts legislature, some of them are written with code language in them that still further demoralize or impact women's lives in a way that is not positive, particularly when you look at the incarcerated women population. There are about 200 women incarcerated in the Mass DOC. When we look at houses of correction, there's a lot more. We have a prison that is here in Massachusetts, but everyone that's incarcerated is actually in the care and custody of the Commonwealth. Your legislator has a duty under law to care about those folks that are in congregate care. But lately, and throughout time, we haven't really cared about the women who have been incarcerated. And so thank you to Families for Justice for Healing for ensuring that we know about the moratorium and leading on that. But those are the ways that I've looked at military. I can't even say the words tonight because I'm so tired. But the idea is thinking about in the words that we write in our legislation, there are not every Democrat is the same Democrat, so you'd be surprised on language. But Massachusetts has a long way to go to make sure that reproductive justice is shared to all people.
Thank you. I'll pause for a second in case Chris or Sashi have anything to add.
Yeah, so just to go along with what Senator Miranda said, I want people to understand that, yeah, we're in Massachusetts, rah, rah, it's great. I am thankful, right? I can't find another place that I want to be in. But at the same time, it's not all perfect, right? So I think, just to lift up, for example, the Healthy Youth Act, or Healthy Youth Bill, which hasn't passed yet. And she could probably talk better about it, but this is a bill that has been on forever since before I came on the board of Planned Parenthood. Since I remember testifying for the Healthy Youth Bill when my daughter Genevieve was a baby. She's 8 years old now, and it still didn't pass. And the reason why I say this is when I tell you about the bill, you'll be like, it should pass. All it would do would pass that any school that decided to teach sexual health education, it just makes sure that the curriculum is medically accurate, age appropriate, culturally competent, inclusive. It's not saying what you need to teach, and it's not saying you have to provide a sexual health education. It just says, if you're gonna do it, let's do it right? We know, for example, abstinence only education doesn't work. And that bill still hasn't passed in Massachusetts. So the reason why I bring this up is to say, we don't all get along. We don't all feel the same way. Things are better here than perhaps other places, but we need to vote. You need to make sure that things like this, which I think should be a no-brainer, because I remember the first time I testified with my little daughter, she's adorable. I'm like, make this happen for her. She's 8 years old now. It has not passed, and we don't have abortion as a nationwide right anymore. Like, what's going on, right? I'm in like a bad TV show. I need to get out. So that's what I mean is, don't be complacent. Vote in your local elections, your state elections. We need more people like Senator Miranda there. She can't do it alone as much as she wants to, right? We need every single vote.
And I just want to also uplift, that one of the things, so a lot of our women have been, who are incarcerated for long terms, like typically they are incarcerated between like 22 and 28. And then they're sentenced to excessive sentencing. And then typically sometimes when they come home by 30 years old, a lot of these women have hysterectomies. And I live in a community where, I don't even know anybody who is in the community right now who has a hysterectomy. But then when I think about how many incarcerated women have hysterectomies, you can't help but think like, what are we doing? And then when you start talking about when a woman comes home at 30, 35, 38 years old, from being incarcerated and she has a hysterectomy already, she's never going to be able to have a child. And she's missed out on that opportunity. And so I just wanted to uplift that also, because, you know, what Senator Miranda said to me about legislators having an obligation to women, and they also have an obligation to the incarcerated women. And so I want to uplift that as for legislators to start utilizing that obligation and like start being the voices for our incarcerated women, because it is not okay that women are having hysterectomies at 35 years old. That's insane. Women should still be able to come home and have a baby and have a beautiful family and live out a healthy life when they come home, because they still matter as well. And also, I just want to, you know, just acknowledge, just thank you for your leadership too. And you were also my Delta Gym mentor, so I never really got to tell you about that. So I just wanted to thank you. And I just wanted to just leave y'all with that, because a lot of times when incarcerated women, you know, come home, the trauma of incarceration continues. And, you know, when we are talking about, you know, I'm grateful that I have a beautiful baby girl, but, you know, I know when I sit at the table with women who are my age and they have the only option they were offered when they were in prison was a hysterectomy, and they accepted that because they didn't use their voice or nobody listened. You know, I know it breaks their heart, because it breaks my heart. And so, you know, I want to encourage not only legislators, but I also want to encourage schools. Like, I know you graduated from Northeastern and y'all have a platform to do research and use that research as power and call out, you know, DOC and people that are responsible for the healthcare of incarcerated women to do better. That's all I just wanted to leave y'all with right now.
Thank you, all three of you, for adding all those really critical points to that question. The next question was about any particular legislation that we can contact our legislators about, but there's been a lot of, you know, response in the chat to that. And so for the sake of time, I might move on to the next question. But so far, I've seen the Healthy Youth Bill come up in the jail and prison moratorium. And hopefully we can come back to that question at the end in case there's anything else to add. But the next question is, how do you see the anti-LGBTQ and specifically anti-trans bills across the country relating to these issues within women's health? And again, any of the three of you can feel free to unmute and answer.
Well, I just want to let you guys know. So I'm in the Women's Caucus and I'm the vice chair. And I was going to write in the chat that we're working on a birth justice omnibus bill. And so it's going to include a lot of the stuff that around doulas, midwives, birth centers. Just wanted to share that. So I'm going to put that in the chat. But we have also created a subcommittee in the reproductive justice work within the Women's Caucus and outside the Women's Caucus that is about gender affirming care. And there's specific legislators, Julian Sear, Rebecca Rausch. Those are the folks that are really working to ensure that the anti-trans, anti-LGBTQIA community is not left out of the conversation as we're thinking about reproductive justice. I don't work on those bills specifically, but I've been a big supporter because of the work that I've done with the DOC. I didn't get to share this, but Sashi, we have something else in common. My birth father and my brothers all were incarcerated. Actually, the month that I walked onto the campus of Wellesley, my father was then deported, and my oldest brother. And so I know family separation, I know homicide, I know incarceration since I was 9 years old. And so that has really led me to be a person in the State House that leads from a heart of a survivor, but a heart of someone who understands that the carceral situation in Massachusetts is not better. 1 in 5 people are serving life without parole. But I just want folks to know that if you want to learn more about the gender affirming care, and we've included a lot of those clauses in the recent legislation. So we had passed the Roe Act a couple years ago, and then we came back after the nation fell apart with Roe. We came back and strengthened our laws so that folks wouldn't get subjected to not only fines or imprisonment if they performed abortions or came to our Commonwealth to have abortions. And what was largely missing out of that was the language around all different types of communities that are going through their reproductive journeys. And so I believe that we have really strong legislation, and it was led with the Beyond Roe coalition that Planned Parenthood and Repro Equity Now were a part of, and I can try to find that key legislation. So I just wanted to share that that is being talked about at the State House, and you have some really good supporters, legislators who are leading those conversations and those sort of making sure that we're not doing anything anti-trans or anti-gay here at the Commonwealth, in the Commonwealth.
And something I want to add to that is also that the Aspire Center at the Planned Parenthood League in Massachusetts is also conducting actual research looking at the barriers that are faced not only by youth, but also by LGBTQ youth, in particular in this post-Roe world, and trying to cross those lines so that we can get research and understand it better to better tackle this issue. And something else I want to mention whenever I hear LGBTQ and what's going on, if you don't know, you don't know, but I'm telling you now, it's happening all across our nation. You've probably read about it, but within our libraries and our schools and our curriculums. A lot of books are getting pulled from public libraries, school libraries. And if you look at what they're having to defend against, it tends to be books by or for authors of color, LGBTQ youth, and other folks that are in marginalized populations. So I say this just to be like, it's happening everywhere. We are battling on all fronts, right? It's not just the medical center. It's not just at the legislature. I mean, it's happening in your public library. And if you don't think it happens just in Massachusetts, it does. There have been people who've come and protested at story times, for example, wanting to pull in the library where you should be able to get information. They're trying to censor and determine what I can get. That's totally not cool, right? So it's happening everywhere. And there are places you can advocate, not just with Planned Parenthood and APHA, but also the American Library Association. And what we're having a legislative day here in Massachusetts for our libraries. I'll see you soon, Senator Miranda, in about a week. But it's happening on all fronts.
Thank you both again. And one thought I have is that, Catherine, maybe you and I can work together to add the bills that have been mentioned to the resource page that we're going to send out, just to save time. And in the last few minutes, I was going to ask Sashi if you have anything else to say about the question that was put in the chat about why are prisons giving hysterectomies to women?
Well, we're doing the research right now to figure that out. It is hard to get a lot of information, and it takes time because you have to actually build a relationship, which we have, with women that are incarcerated, so that way they can give us access to their medical records, so that way we can kind of like track that process and figure out where did it begin, why did it start, and why did it happen. And so again, that's why I'm always like, encouraging. And I also want to shout out my mom, Andrea, because she is also a Northeastern alumni. She graduated from Northeastern Law, and she would be so mad if she knew I didn't shout her out for that. And the many other things that she does as being the founder and executive director of the National Council for Incarcerated, Formerly Incarcerated Women and Girls. But I'm always encouraging students and researchers to, help us. We're on the ground creating out infrastructures, reimagining communities. We're supporting people, mutual aid, mutual housing. We're, creating policy. Senator Miranda, I know I'm that Black girl that was like, last year was my first real experience really pushing for the prison and jail moratorium bill, which we passed, and the governor vetoed it. And it really broke my heart because I'm like, we spoke, Massachusetts spoke and said we do not need a new women's prison, yet you vetoed our bill. And I'm like, how could you even have the power to do that? Like, we could do so much better. And so we're using all of our resources to create a better world, create a better community, create a better Massachusetts. And we don't have enough resources to do everything, which means we don't have the resources to research everything and to keep foiling the DOC for health records and all of that. Like, we can't can't do that all the time. And so we need people to stand with us. We need researchers to stand with us so they can help us with that process. And so that's why I'm always leaning on students who want to, internships and all of that, so that way they can support us and we can have all the answers, because we don't have the answers, but we do know that women are coming to us with this issue and it's a problem for us. So we'll get to the answers, but right now we're still working through it.
Thank you. I'm going to pass it over to Catherine. That seems like, I think we're at time. Yeah, 7:01. So we'll finish up the Q&A section there.
Thank you again. It's just been wonderful. And I know I speak for everybody who's on this webinar, and I especially speak for Massachusetts Peace Action and the Fund Healthcare Not Warfare working group, that whenever we can be of assistance to you, please let us know and we can pull out all the troops. Oops, sorry for a militarization metaphor there. Pull out all, yes, I'm getting chastised. But thank you so much and really appreciate it. And we'll definitely be in touch, and please be in contact with us. Thank you for your time, your energy, and your creative ideas. And thank you for everybody else who is here. Thank you, everybody, and have a safe week.